Thank you very much indeed. You've given us quite a hard task in this session because so much important has already been said, so many strong messages have come over, and also, of course, my background as a public health researcher, I wouldn't pretend to be an expert in societal transformations. And I think it's important to try to put the words that I'm going to say in the frame of how we take ourselves, how we take humanity onto a much more sustainable trajectory. I'm going to use some of the insights from the commission that I had the honor to chair a couple of years ago, the Lancet-Rockefeller Commission on Planetary Health, but also to try to summarize, I think, some of the ideas and important concepts I've heard during this meeting. So one of the standout phrases from our commission report, which was tried to encompass both the effects of multiple environmental pressures on human health, but also potential solutions that would take us towards a more sustainable way of living and a more healthy way of living. One of the concluding sentences was that the solutions lie within reach and should be based on the redefinition of prosperity to focus on the enhancement of quality of life, delivery of improved health for all, together with respect for the integrity of natural systems. And the reason I mention that is because it makes it very clear that technical issues are very important, but also values are important. And unless we put natural systems at the center of our economic and political life, we will not achieve the desired effect. And we use the health argument to do that, not the environmental argument, because we feel that the health argument is more relevant to us, but it's probably more relevant to the public at large. So let me try to summarize some of the key statistics. First of all, fairly well known around the so-called health co-benefits from the low-carbon economy, because that's probably the area that we know best, and I'm going to start with that. Some of the figures have already been suggested during our discussion, but I want to just draw your attention to one or two headline reports. And one of these I think that's important is the International Energy Agency Special Report on Energy and Air Pollution, which makes a very important conclusion that a modest percentage increase in investment in clean energy can save over 3 million lives in 2040, while providing energy access for all, lower energy import bills, and leading to a peak CO2 in 2020. So this is a very well-informed body in terms of its central role in energy policy worldwide. And I think it gives us an important signal that there are many policies that we can put in place that will achieve multiple benefits, both to climate, to wider society, and to human health. There are modest costs in terms of percentage increase, but if you look at the marginal benefits from reducing air pollution, they usually add up to between $50 and $300 a tonne. And if you include those, then of course they can help to offset, indeed outweigh many of these costs. It was also very apparent to us that the current system depends on taxes and particularly subsidies that currently are not driving us in the right direction. So the IMF tells us there are large energy subsidies, perhaps equivalent to about $5.3 trillion. Many of those are related to our undercosting of the health effects of local pollution. Some of them are direct subsidies. And as we've already heard, only 13% of global greenhouse gas emissions are covered by carbon pricing. So redirecting those subsidies, they're not just in the energy sector, they're also in fishing, they're in food, a range of other sectors, driving us in the wrong direction, often protected by very powerful vested interests. So redirecting those subsidies, some people have suggested we take away energy subsidies, obviously put them into renewables. Some people even suggesting we subsidize universal health coverage, for example, which is an innovative approach. So these are the nationally efficient carbon dioxide prices, again, from the IMF. They exclude the long-term carbon benefits. They're related to the air pollution reductions and the valuation of those air pollution reductions. And what they show us is that different countries have different nationally efficient CO2 prices. So for Russia, for example, perhaps about $80 a tonne. For Italy, considerably less, maybe around $15 a tonne, something of that order. And it really reminds me to raise a particular issue here. Why have carbon prices been, although they're theoretically attractive, actually so poorly taken up? And one of the issues I feel is that we've used the wrong arguments. We called them carbon prices. Maybe we should, carbon taxes, maybe we should call them health taxes. These are taxes that will be good for your health. We can reduce income tax, we can reduce value-added tax, we can put them onto these carbon taxes. And I think that will be a very attractive political argument, and it's not being used sufficiently enough. I want to also reiterate what Ram has shown, but perhaps make a slightly different argument. This is about the need to address both carbon dioxide and short-lived climate pollutants. And one of the arguments for addressing short-lived climate pollutants is also the health argument. So perhaps 2 million or so annual premature deaths could be prevented from outdoor air pollution, and also increases in annual crop yields from reductions in methane. So it's a combination of black carbon and methane reductions. And I do wonder actually whether the health benefits of methane have been understated given what we now know. So there's a very important health argument both for reducing CO2 emissions, particularly coal, for example, other fossil fuels, but also short-lived climate pollutants. But I think it's pretty clear that the future of planetary health will depend on cities, because cities are responsible for about 85% of the global GDP, about 3/4 of the global energy-related greenhouse gas emissions. And this slide just sort of summarizes one of the issues around urban design. It shows us Atlanta in the US comparison with Barcelona. Very similar populations, about 5 million people, but a dramatic difference in their surface area. So Atlanta's around 7,000 square kilometers, Barcelona about 700. And that means they've got transport-related greenhouse gas emissions very different, probably about 1/6 in Barcelona. And I think that gives us a clue as to how we need to develop cities in the future and also retrofit cities that have been perhaps mal-designed for a different historical era. So when we're designing new cities, we need to design them much more compactly and think about the health and environmental benefits of urban design. This is particularly apparent in Africa. We've already heard about population growth in Africa, perhaps 4.4 billion people by the end of the century. That's clearly unsustainable. And clearly we need to reduce that rate of population growth, including by education of women, etc. But there are opportunities in the urbanization of Africa, and that is to create cities that function much more efficiently and effectively than the kind of cities that we have in the West, that they're much more energy efficient, potentially designed with human health and sustainability in mind. Combining both adaptation to climate change, in other words, reducing the urban heat island effect, for example, with mitigation, in other words, reducing greenhouse gas emissions. So I think that's a major challenge for the future. With China's investment in Africa, for example, there's a major opportunity to lock that investment into sustainable cities rather than the current often chaotic and informal settlements that we see at present. We and others have done a lot of work on the health benefits of low-carbon transport and active travel. So you can get reduced air pollution, of course, through greater use of efficient public transport, electric buses, low-emission public transport, and also active travel. That's walking and cycling. And we've done estimates now in a number of cities, London, Delhi, and Sao Paulo. They all show different types of benefits depending on the background patterns of sedentary lifestyle, which is a major killer, by the way, perhaps 3 million people around the world every year, and also the air pollution levels. But they all show benefits. And we've also demonstrated in the UK, at the bottom part of the slide, that if you factor in these reductions in mortality and morbidity, they could also help to offset some of the expenditure in our National Health Service through reducing the prevalence of diseases like diabetes, dementia, heart disease, which are related to sedentary lifestyle and to some extent air pollution as well, as we've heard. And we are seeing around the world much of the innovation in climate change mitigation and adaptation is occurring at the city level. If we look back at Paris, I think it was over 7,000 mayors signed up to statements that they were going to reduce dramatically the environmental footprint of their cities and also promote more resilient cities. And we are now seeing sustainable mobility trends scaling up around the world. Some of them are summarized here, everything from metro systems, public transport, car-free zones, low-emission zones, bike-sharing schemes, and so on. And many of these have major benefits, potential benefits for human health. As individual clinicians, of course, it becomes easier to advocate for one's patients to leave your car at home and take the bus, walk, or cycle. And I sometimes think we should put a health warning on cars, because cars are actually, as we understand now, increasingly hazardous to our health, not just people outside them, but people in them, because of exposure to air pollution, but also we know that many of them don't get the physical activity that they need. But it's not just cars, of course, it's not just transport, it's also green space. Green space is important in cities for the protection of biodiversity. It can help to reduce the urban heat island. It can help to absorb extreme precipitation events, and so on. But it also has benefits for mental health, as summarized in this slide. It just shows you a summary of a number of studies showing that the displeasurable moods are reduced on the left side and the pleasurable moods increased from a variety of different studies. So green space has the potential to improve human health, improve physical activity, and improved mental health. There's still quite a lot we don't understand about how that operates, but there is this emerging evidence base which is increasingly being taken up by urban planners. But we need to have a long-term vision about where cities are going in the future, and this is just one example of those taken from a Finnish city, which I won't attempt to pronounce the name of it. But you can see that what their vision of the future is towards 2050 of a city founded on renewable energy, sustainable transport. Of course, they're seeing waste as a resource, so they see the circular economy as being key to their strategy. They've included health, healthy food, for example, healthy food system, water, valuable water, water recycling, and a strong emphasis on local solutions, sustainable communities. And we have to bring these communities, these solutions down to the community level. They cannot be delivered top-down. We and others have looked at sustainable housing. In the UK, we have a lot of obsolete houses. I happen to live in one. I'm quite fond of it, but it is quite obsolete. This slide just shows you if we insulate and ventilate those houses, we can achieve very, very high standards of energy efficiency. We don't often talk about energy efficiency. We talk about renewable energy, but energy efficiency is very important because it also helps us to reduce the need for sustainable energy, makes it much easier, much more tractable. And it can improve human health. But you can't just seal up houses, you also have to ventilate them, because otherwise you increase indoor air pollution. So that can reduce greenhouse gases, improve human health. In low-income countries, we need to aim for integrated solutions. And I do have some concern when I see, for example, indoor air pollution just singled out in isolation. Very, very important, of course, but we need to think about integrated solutions that will address water sanitation, sustainable lighting like solar lights, abolishing kerosene lights, resilient housing that takes into account extreme events, and of course clean energy is an important part of the mix. And some houses where you're based in malarial areas, for example, you also need to design them to prevent the ingress of mosquito vectors that may be increased as a result of environmental change. So we need to think about co-designed housing with local communities that address all these public health issues in an integrated way. And then food and agriculture. We've just touched, we've had quite a, I think, extensive discussion on that, and I fully agree that food and agriculture has been rather neglected. It's absolutely crucial in sustaining health in the Anthropocene and reducing the tempo of land use change, which is driving biodiversity loss and contributing to climate change. There are many solutions. We touched them in the earlier discussion. If we start to think about solutions that improve health as well as improving the environmental footprint of food systems, then obviously healthy diets are an important component of that. We've done a recent systematic review looking at the health benefits of just following healthy dietary guidelines, WHO dietary guidelines. Reduces greenhouse gas emissions by about 12%, largely because of the reductions of animal products, but also, by the way, reduces land use and water use, as we've heard, also an important dimension of environmental change. Vegetarian diets may not be culturally acceptable at the moment in every society, but they are the norm in some societies, and they result in even bigger reductions. But I do want to emphasize what Professor von Braun said earlier, that dietary change is very important from the health point of view. But if we're talking about minimizing the environmental impact, we also need to think about sustainable intensification, which will probably have a bigger effect on the environmental footprint. But we need to think about both health and environmental footprint in an integrated way. And of course, food waste, food loss, also an important part of that agenda. People have looked at different ways of promoting low environmental impact and healthy diets. You can have regulation, you can have food labeling. I still can't see from looking at the packaging on the food I buy where it actually comes from. I should be able to see what the environmental footprint is. I can't do that. Surely as consumers we should have the right to see that. Others have looked at greenhouse gas taxes on food commodities, the equivalent of carbon taxes if you like. The danger of those is you can make the health of poor people worse if you design them badly. You can increase the cost of things like fruit and vegetables. It'd be a bad idea. But Marco Springman and colleagues have looked at how you could implement optimized taxes. to reduce the tax burden on the poor, promote healthy diets, and reduce greenhouse gas emissions. And they've suggested perhaps nearly a gigaton of CO2 equivalent emissions reductions and 500,000 avoided deaths if you could implement a kind of optimized greenhouse gas tax. So I think it's an interesting perspective. We also need to link the preservation of natural systems, preservation and protection of biodiversity, reducing greenhouse gases with human health. And there's an increasing body of evidence around forest conservation, around the use of ecosystem strategies to promote sustainability and resilience, for example, the use of mangroves to protect coastal regions from floods. And this is an example from the Brazilian Amazon from colleagues Subrendra Patanayak and colleagues at Duke, showing how forest conservation can reduce disease risks from malaria, reduced air pollution and fewer acute respiratory infections, and also cleaner water, less diarrheal disease, because intact forest can actually filter water, filter out microbes. So building up that evidence base to support these kind of conservation policies is going to be really important. We shouldn't neglect the health system itself. The health system is an important contributor to greenhouse gas emissions. In the States, it contributes about 10% of them. In the UK, about 3%. Interestingly enough, I always used to think it was because of the way we use energy in hospitals, and that is important, but the biggest single contributor is the things that we procure. In other words, the things we buy, particularly pharmaceuticals, which are very energy intensive and use a lot of fossil fuels, also the heavy equipment that we use. So environmentally sustainable health systems, reducing energy use, increasing resilience, providing care closer to home through primary care, affecting the behaviour of the health workforce. In the UK, over 1 million people work for the NHS. They're an immensely powerful group of people in society, and bringing them on board will have big effects. And some hospitals and health facilities are increasingly promoting healthy, low environmental impact diets in their canteens, for example. Looking for disruptive changes for planetary health, and this is an interesting comparison between Easter Parade on Fifth Avenue in 1900. You can see it's all horse-drawn carriages. By 1913, there were no horse-drawn carriages or cars. So that was a disruptive change, maybe in a way that we are now beginning to see it can be counterproductive. So we need to search for disruptive changes that will be zero carbon, health-promoting disruptive changes. And this is one vision from an Argentinian designer. It says how oil could be replaced by orange juice. In other words, these are about machines that promote active travel within the urban environment, maybe electrically assisted, which are widely accessible and cheap. But perhaps the overarching vision that expresses where we want to go may be the circular economy, which we've touched on once or twice in some of the talks here. And that economy is really founded on much less waste, more remanufacturing, reuse, repair, the sharing economy, and the reduction of residual waste, an economy that's also powered on renewable energy. And it seems to me that we do have to have some kind of overarching vision of where we want to get to. But I think what's important is to see where health is in that, because you could implement the circular economy in a more or less healthy way. You could have a high throughput economy with a lot of the recycling being done in sub-Saharan Africa with hazardous waste dumps, as we have at the moment, 60 million people exposed to hazardous waste. Or you could have a healthy, equitable circular economy with a lot more sharing, a lot less waste export, and much higher standards of occupational and public health. So it's crucial that the public health community is involved in the articulation of what it means to have a circular economy. So in concluding, the commission that I chaired suggested we need to meet 3 challenges if we're really going to secure planetary health in the Anthropocene. One was the imaginational conceptual challenge. And that can be exemplified by the fact that we still use GDP as our main metric of human progress, despite its flawed basis. We know it has some benefits, but it also has a lot of disadvantages. And we need to put human health and the sustainability and the respect of natural systems much more at the center of our political discourse. There are knowledge challenges. We've funded a lot of research on biomedicine, which is absolutely essential, but it's become overwhelmingly dominant. And all praise to the Wellcome Trust for getting into this field and actually putting money into the kind of planetary health agenda. But we need many more funders to stand with them and put much more money into the development. And I would say the synthesis of knowledge. When we look for synthesis of knowledge in our commission, we found relatively few systematic reviews, and what there were, many of them were poor quality. So we need to develop that synthesis. And finally, implementation. And implementation it's about individual behavior change, which we know is not easy, it's incremental, but also about creating society-wide mechanisms for implementation. And that does mean, as Jeff Sachs has reminded us, confronting very powerful vested interests. We're very experienced in that in the public health arena because we've had conflicts with the tobacco industry for many years, and they've been long, drawn-out conflict, which is even now, I think, not fully resolved. But we do need to tackle these head-on. But where we have people working in industries that are working towards much more of a sustainable SDG-directed model of business, then we really can make common cause with them. So what we see now is an economic system in which the legitimacy of business as usual is eroding in front of us. It's coming to the end of its road, I think. We need a much more sustainable economic model. The Sustainable Development Goals can be a window which will take us into the next sustainability transformation, which needs to occur before the middle of the century. And I leave you with the idea that perhaps what we need is now a sort of global movement, if you like, a movement for planetary citizens, particularly engaging the young, science-informed. It can't be led by scientists, I don't think, but it can be informed by scientists, mobilizing faith leaders, business leaders, young people, to enable us to move towards a system where we can really support planetary health in the Anthropocene epoch. Thank you very much.